government promises what? The government cannot efficiently and effectively provide health care. I believe that having the government in charge of health care for American citizens will be a disaster and a monster from which we cannot escape. We can see the mess the government has made of Social Security, Medicare, Medicaid, immigration, Amtrak, Fannie Mae, Freddie Mac. Why should we believe that the government can efficiently manage a national health care plan?
I don't want and I will not support any plan or any bill or any law that would have the government run the entire healthcare system in the United States. Despite some of the legitimate questions you raised about Medicare, I strongly disagree with those of you who would get rid of the Medicare program. Many of you said you want to get government out of healthcare. Folks, Medicare is a government healthcare plan. Medicare is what we've got to do is figure out a way to hold down the cost of healthcare in general, because it's those cost increases. For example, I think we ought to respect the right of those to ask questions and their right to have questions answered. I think the fact is that for Medicare, if we don't get people out of the emergency rooms, that, as I said earlier, it costs 10 times more for the same care that you get in the primary care doctor's offices. If we don't bring about
Congressman, if people will stop yelling "shut up" at each other, it would greatly advance the discussion.
If we don't get control of the cost increases that are expected to double healthcare costs for all of our families over the next 5 years, then we're going to eventually see Medicare put at great risk. The bill, as written in the House, would actually extend the solvency of the Medicare Trust Fund by 5 years. But one of the real concerns I have, and I want to spend a lot more time studying this, is whether the cost efficiencies of Medicare proposed in this bill are real efficiencies, or if they're cuts in services. I don't want them to be cuts in services. I want them to be real efficiencies. So, you know, the bottom line is some would have the government run our healthcare system. I disagree. Some would have the government get out of healthcare altogether, and that would mean getting rid of Medicare and Medicaid. I think that's wrong as well. The reality is we have a public-private system today. And without Medicare and Medicaid, as I said earlier, you go ask the hospital administrators, what would happen to the hospitals in Johnson County if you got rid of Medicare and Medicaid tomorrow? So the reality is we have a public-private partnership, and we need to strengthen that partnership. We need to strengthen the competitiveness of the health insurance industry. And one of the things that Jim was referencing, I'd like to say is important, we need to have more incentives for these great young people going into colleges of medicine to go into primary health care. Right now you make 10 times more, you make $1 million a year for orthopedic surgery. You might make $150,000 a year after all the years of expenses in medical school if you're a primary care physician. And those numbers change. It may be 7 to 1, maybe 6 to 1, maybe 5 to 1, 10 to 1. But the point is that we have really put disincentives on bright young people to want to choose family practice. And I think we need not to punish the specialists, I'm grateful we live in a country with incredible heart surgeons and oncologists. They're doing miraculous work at our hospitals, but we do need to have better incentives for many of our physicians going to primary care, and I think that can hold down costs. If we can hold down costs, we can help preserve the services and the viability of the Medicare system.
Randy Haney from Glenrose will ask the next question, and because of time, then we'll go, well, we've already heard from Dan. Then Barbara Rose from Cleburne will ask the last question. Randy Haney from Glenrose.
I think for clarification, when you asked if we believe that the government should get out of health care, we were referring to the current system. It's not a reasonable suggestion to just end Medicare and Medicaid. The audience and myself are responding to what's being proposed now. And my question is, I just don't understand. What part of the Constitution says that the government can be in charge of health care?
Randy, I don't want the government in charge of our health care system. But Article 1, Section 8 of the Constitution is what allowed the government to get involved in Medicare in 1965, and allowed the government to get involved in Medicaid, allowed the government to get involved in VA health care. And I appreciate your clarifying your position on Medicare and Medicaid, but let us be clear also, you can't have it both ways. You can't say, for those who have said it, I want the government, there are some in our town hall meetings who have said the Constitution does not allow the government to be involved in health care. That's your position. That's your position. You can't have it both ways. You can't say the Constitution doesn't let the government be involved in health care, and yet it's okay to have Medicare and Medicaid. So the bottom line is we've got a public-private partnership. It's critical for the success and the quality of the private health care system. I want to continue that public-private partnership, and I think, you know, Article 1, Section 8 of the Constitution is what gives us the authority to continue that partnership, even as I oppose those who would propose a completely government-run health care system. Thank you.
The last question of the evening. Ladies and gentlemen, the last question of the evening will come from Barbara Rose of Cleburne.
Mr. Edwards, my question is, why does this administration, why this health reform bill? Why? Why do we have, why this? Why do we have to tear down the whole healthcare system for this? Why can't there be another way? And I know you've heard these questions here already tonight of the tort reform, or allowing the insurance companies to cross the state lines and be more competitive and bring the prices down. Because if I understand it, for health care for everyone, what we want is for the premiums, our health costs, to be down to where it's affordable for everyone, not just given to us, right? So why this bill? Why does it have to be a yes or no on this bill? Why can't, why does it have to be destroyed from the very foundation?